We are going to be performing the Foley catheter insertion on a female today, but I would like you to also be aware you can also do this procedure on a male. The first thing you would do is get your physician's orders, and you're going to look and see what they want you to perform, and it does say insert Foley catheter per sterile technique on Sandy Beach. So once I clarify my orders, I will gather all my supplies before going into the room. I will need a Chuck's bath blanket, a Foley catheter kit, a wash basin with washcloth, towel, soap. I will also need a leg holder for the catheter that we will apply. Once I have all my supplies gathered, then I will be ready to go into my patient's room. Knock, knock, knock. Hi, I'm coming in to do a procedure on you. I'm gonna just put everything here real quick. Oops. Sandy, I just would like you to state your full name for me.
Sandy Beach.
All right, Sandy Beach, ID number 47672. Can you tell me your birth date?
000000.
Okay, and are you allergic to anything such as iodine, shellfish, latex, anything like that?
No, I don't have any allergies.
Okay, so now that we have verified our patient, I'm going to explain to her that we are going to insert a Foley catheter into your bladder. Your physician wants that to drain your urine, and it should make you feel a little more comfortable. So at this point, I'm going to first clean everything off. I'm going to leave my kit here. I'm going to first go ahead and grab of my water basin. We're going to go ahead and raise you up to my working level, which is about waist high. I'm going to lower the side rail on my end so that it's out of my way, and then we're going to go ahead and expose your patient. And we're going to put everything high enough so it's out of the way. I'm going to go ahead and put Chucks down to save our bed from getting wet. And if your patient tends to get cold, you can go ahead and take a bath blanket and throw it over the top of them to keep them a little warm while you're doing this. Raise this up to my waist level. All right, now we're gonna put on some clean gloves. I have my soap and water. So we're gonna go ahead and clean our patient. You're gonna take with one part of the washcloth and clean the far end. New part, clean the near end, and your third one down the middle. Gonna rinse, and we're gonna dry just like we did in the beginning, each with a different part. And then you're gonna take your towel and gently dry them off also. Once all that's completed, you can put this aside, and you're going to remove your clean gloves correctly. And now we are ready to start our sterile procedure. Now, as you're doing your sterile procedure, you need to remember to pay attention to your principles, which are back on your sterile field, making sure everything's at waist height. You also want to make sure you're aware of your 1-inch border and that you're not going to cross over anything in your kit. We're going to save the instruction for later so we remember what to chart. You take this bag, fold it over as deep as you can, put it next to your patient so that it's not going to end up getting in your way as you're trying to throw stuff away. Now we're ready. She's ready, I'm ready. So we're going to go ahead and open our kit. We position the patient with her knees bent so that you have easy access. We're going to take the initial and pull it away from you to the corner of the table. Then side, side, and make sure to try and hold it down. And then it should be square, so you shouldn't have to mess with moving it. Now the next thing you're going to do is grab from whichever side you want and pinch the very top absorbent pad, and you're going to just hold the edges, and your shiny side's going to go down. So you're going to put that in between your patient. If it messes up, just leave it until you can put your box on. You should be fine. Now you're going to go in, pinch, and get your glove wrapper out. You're going to take a step to the end of the table and open up your glove packet. As you're putting your gloves on, try and crease this so it doesn't pop back on you. Then step over to one side, pick up your first glove by the cuff, move away so that you don't reach over the other glove laying on the kit. Then once you have that one on, you can hold the edge of your glove wrapper so that it doesn't move on you as you're trying to get that glove picked up. Once you pick that glove up, have your sterile gloved finger out. Insert your hand and pull your gloves on, and now you're going to pray as you go to your patient. So keep your hands out so that you don't end up touching anything on your clothes. And now you're going to pick up your fenestrated drape. You're going to open this. You're sterile to sterile now, so you can touch this anywhere. You're going to carefully put this over your patient and just let it drop. You can fix it later once you're going to contaminate this hand. Now we're going to look at our kit, and you're going to go ahead and separate your kit without crossing over anything. Now the whole point of the kit is it doesn't matter which way you do it, but as long as you have everything ready before you go and touch your patient. So the first thing I'm going to do is open my iodine. I'm going to go ahead, pour it over my cotton balls, and drop from the waist. Then I'm going to put that back over there. I'm going to go ahead and remove the blue sleeve from my catheter, being careful not to reach and cross over anything in my kit. These tend to flop, so I usually just throw mine over there instead of trying to get it into the garbage bag. Now the next thing I want to do is my little attachment that I have to add the water to is way on the other side. So I'm going to pick this up, turn it towards me so it's more easily accessible, and I'm going to go ahead and take this off. And you need to really push this, because if you don't, once you go ahead and try and insert it with one hand, it will fly off and squirt everything. So then carefully put that in. The next thing we're going to do is loop. So you can do this one of two ways. Some people squirt it in here, other ones pull this out and dip it in there. Either way is acceptable, it's up to you. I'm gonna go ahead and squirt since it's right over here. And then I'm just gonna dip my catheter in there. And we're gonna put my catheter back down. And at this point, I'm double checking everything is done and ready to go. So I'm gonna go ahead and put that back on top. I'm gonna grab this and have the cotton balls pointing towards the patient. And I like to try and do it just from the top as I'm putting it down so that I don't end up making a mess. The next thing you're gonna do is spread your patient open for the labia majora to get to the labia minora. And at this point, this hand now is considered contaminated. So you cannot move this hand off of there and touch anything in your kit. So I'm gonna go ahead and pick up my first cotton ball. And you always wanna be careful that you're not reaching over your patient or your cotton balls that are there. So you're gonna clean down far side, toss, get your second cotton ball, come down the near side, toss, and then you're gonna go down the center, toss. If you have extra ones, you can go down the center again. Otherwise, you can throw your forceps away. Then I move this out of the way. And you're gonna pick up your catheter and you're gonna tell your patient to bear down. You're gonna start inserting 2 to 3 inches. At this point, you should start seeing urine. Then you're gonna go another 2 to 3 inches to make sure you're in the bladder. You wanna make sure as you're inserting that you're not touching the labia. You're moving your fingers back so they're out of the way. Once you get to your extra 2 to 3, you're gonna grab and hold with them contaminated fingers. And at this point, you need to realize if anything goes wrong, you can't insert this catheter any farther because it is now contaminated. So now you're gonna go ahead, inflate your balloon. You wanna keep your thumb or your hand on that syringe plunger until you pull, make sure it's secure, and then release so that you don't get fluid back in here and then it shoots out. So now you're done with that. At this point, our sterile procedure is over. I always change my gloves because you've been holding her open, you have betadine on them, so you're gonna go ahead and now put on a clean pair of gloves. At this point too, you want to be assessing the urine for color, amount, clarity, because you will need that to document once you get all done. So at this point, if there is urine in here, you can clamp it so it doesn't go back up into the bladder. You're going to go ahead and hang this on the non-movable part of the bed, which there's a little hook down here. And then you're going to take and apply your catheter secured equipment. And you're going to leave a little lax here so that it's not pulling. And there's a number of different kinds. Then you're going to go ahead, you would actually rip this in real life, clean her up, get rid of all your supplies here. And put her legs back down so she's comfortable. Get rid of that. And cover her back up. I'll remove my gloves. Put her down, give her her call light, ask her if she has any questions, if she's having any pain or discomfort. And then once everything's cleaned up, you're going to go ahead and document time, date, your initials, the Foley catheter that was used, the size, what you inflated the balloon with, the urine amount, color, clarity, and document how the patient tolerated the procedure. And this is the Foley catheter.